Time for morning rounds. The warm air has brought back the critters. No one likes getting bitten by mosquitoes, ticks, and bees, but joining us over video chat to share how we can protect ourselves is Dr. Francis Lee from Christie Clinic. Good morning, doctor. How you doing?
Good morning. Thanks for having me.
Thanks for being here. So we want to talk in particular about mosquitoes, ticks, and bees this morning.
Yeah, so the most common bug bite is probably mosquito bites. And besides being very itchy, they're important because if you scratch too much, it can turn into an infection. Mosquitoes can harbor different viruses, such as the West Nile virus, but that's not too common. With tick bites, the way you know you have a tick bite is if you're walking through the woods or a brushy area, you find a tick attached to your skin. Sometimes you can develop a bullseye appearing rash. But the main concern with ticks is that they can transmit Lyme disease, which can lead to some complications if left untreated. And then lastly, with bee stings, that's another common insect bite. And some people develop a bee sting allergy, although that's not very common, about 2 to 3% of cases.
Oh, wow. Okay. So what are some ways that we can prepare ourselves and prevent getting bit?
Yeah, that's a great question. For all insects, you can use insect repellents. There's some controversy and questions about this chemical called DEET, D-E-E-T, but research has shown that it's safe and effective. If you don't want to use a chemical, you can use insect repellents with more natural products, such as lemon eucalyptus. For mosquitoes, it's good to know that they're most active in the morning and in the evening. So I know we're all sick of staying inside, but it'd be wise and prudent to stay indoors during those times. For ticks, the best way to prevent them is to actually wear protective clothing such as long sleeves and long pants. And then for bees, please don't swat them because you can actually provoke them when you swat them. And don't hang around beehives and flowers, I suppose, things of that nature.
Yeah, you make them mad when you try to swat them away, right?
Yes.
Okay,
Anyone would be mad.
so let's say, unfortunately, we do get stung or bit. What can we do after that happens?
Yeah, with any bug bite, you can use over-the-counter hydrocortisone or something like Benadryl or Zyrtec to help with the itchiness. If the bug bite area becomes more red, more painful, if there's discharge, you might be developing an infection, so you should go see your doctor at that time. With ticks, if you have a tick attached to your skin, it's important to note to use a tweezer to gently remove it. Don't try to use a lighter or try to suffocate them because that can actually make the tick burrow deeper into your skin. And if you feel like you got bit by a tick, I would advise to go see a doctor just to get some antibiotics because Lyme disease is easily preventable and treatable. And then lastly, if you got stung by a bee and you start to have facial swelling or difficulty breathing or scratchy throats, you could be developing an allergic reaction, and it's important to probably go to the emergency department at that time.
So, doctor, a lot of people are worried about Lyme disease, but you just mentioned that it is easily treatable?
Easily treatable. It's just one dose of an antibiotic. So if you have any concern that you got bit by a tick, I would just get treated.
And look for that bullseye.
Yes, the bullseye rash.
Dr. Lee, thanks so much for your time this morning. We appreciate it. Hopefully we don't get stung by a bee.
Yes, stay safe out there.
Have a good one.